Hello and welcome to this presentation. My name is Dr. Ruban. I am a neurosurgeon at Rush Copley Medical Group, where I've been practicing for about 10 years now, and where I specialize in treatment of various conditions of cervical and lumbar spine, with a particular focus on minimally invasive procedures. In today's presentation, we're going to go over various conditions that affect the neck and the lower back. I'm going to talk about common causes and various treatment options for these conditions. So what is probably the most common condition that I see on a daily basis in both cervical and lumbar spine? That condition is called degenerative disc disease, and essentially what it is wearing out of the intervertebral discs between the vertebrae and the spine. This happens almost universally to all of us as we get older, but in some patients, this condition starts at a much younger age and can become quite severe and cause debilitating pain. In other people, this essentially manifests as a finding on the MRI and does not cause too much trouble. So there's quite a wide range of symptoms that this condition can cause. But it is something that we see very frequently on MRIs, and it is a condition that can cause back pain for the most part, and sometimes can cause associated buttock and leg pain in the lower back. Another common condition that we see, again, on a daily basis is disc herniations, and how this is different from degenerative disc disease is the disc that sits in between the vertebral bodies can actually herniate or can be out of place. And you can see an MRI of the neck in this left picture here. And what we're looking at is we're looking at a patient's spine from the left side. So this is the patient's face, this is the front of the neck, this is the back of the neck, and this is the spine. These are the vertebrae here, and these are the discs that sit in between the vertebrae. And as you can see in this picture, there are two herniated discs in this patient. So here's one here, and here's one here, and these discs are protruding backwards into the spinal canal and pushing on the spinal cord, which is this gray structure that you see here. In the lower back, which is the picture that we see on the right, this is a similar condition. So again, we're looking from the patient's left side, and we're zoomed in at the very bottom of the lower back or the lumbar spine. And we see the vertebrae here. These are the discs that sit between the vertebrae. And here's an example of a disc herniation where this disc that's supposed to look like these ones here, part of this disc has protruded out or herniated out and is now sitting in the spinal canal and pushing on a nerve. And here the nerves are these gray structures that you see passing through the spinal canal, and that disc, when it herniates out, protrudes out and compresses a nerve. The most typical symptoms from disc herniations are arm or leg pain. So in the neck, if a disc is sticking out to the right side or the left, it will typically cause a sharp shooting electric type pain down the arm. And in the leg, you would expect pain going in the distribution of a particular nerve. So it'll be a very specific pattern to the pain, depending on which nerve is compressed. So for example, in this patient, what we would expect to see is we would expect pain radiating down the buttock, back of the leg, and then wrapping around into the front of the leg, because the nerve that is compressed in this area is the L5 nerve, which is part of the sciatic nerve, and that's where it travels. Another common condition that we see is stenosis, and essentially what stenosis is narrowing of part of the spine, and it can be caused by various conditions. So for example, in the neck or in the cervical spine, a lot of times we will see these disc protrusions from the front of the spine, and then sometimes also associated with some thickening of structures in the back of the spine. And essentially what that causes is narrowing around where the spinal cord goes through the spinal canal, which can cause certain symptoms such as weakness and numbness in the hands, difficulties with balance, and in severe cases, even weakness and bowel and bladder problems. In the lower back, which is the picture that you see on the right, the stenosis typically causes trouble with standing and walking for long periods of time. And most of the time, patients will complain of weakness or heaviness in the legs or pain in the back going into the buttocks and hips, especially with any prolonged standing or walking. This is typically relieved with bending forward. So a lot of the patients will find comfort in leaning on an object such as a shopping cart or walker, and that allows them to walk or stand for longer periods of time. And that's a very classic symptom of this condition. Another problem that is less common than the ones we have discussed is spondylolisthesis, which is just a fancy word for a slipped vertebra. And you see a picture of this here. So in this patient, if you follow the vertebrae in their spine, they are perfectly lined up one on top of another until we get to this level here, where there's a clear slip of one vertebra forward on another. And this is the most common level where this condition happens between bones number 4 and 5. And typically this condition causes pretty severe back pain, and especially with physical activity. So what are some of the treatment options for these common conditions? So most of the time, we will recommend non-surgical treatment before entertaining any surgical procedures for the reason that a lot of the times, the non-surgical options will be sufficient and effective to treat the majority of these problems. And certainly, we want to view surgery as a last option type of treatment because it's obviously more invasive than the non-surgical options. So for most of the conditions that we've discussed, the typical non-surgical treatments would involve physical therapy. And as you see in the list on the left side, in addition to physical therapy, things like manual manipulation, so chiropractic treatment, therapeutic massage, ice, heat, TENS units are all typically done at the same time, and they're usually the first line of treatment. Lifestyle modifications also very important, especially smoking. So smoking is very bad for the spine and causes accelerated degeneration of the discs, as well as other conditions. Excess weight, so obesity is another one that affects multiple areas of the spine, and again causes an increased rate of disc degeneration, as well as increased back pain. And then posture, so especially for the cervical spine, so proper posture with sitting in front of a computer, for example, can be very beneficial in fixing chronic neck pain, for example. In addition to therapy and lifestyle modifications, medications are typically tried as a first-line treatment. So starting with anti-inflammatory over-the-counter medications, and then moving to stronger medications. And finally, trying injections, which would be delivering steroid medications right to the source of pain, whether that is in your neck or your lower back. So for most of these conditions, we recommend at least 4 to 6 weeks of conservative treatment. So physical therapy, massage, medications, injections, to see if there is any improvement. And if there is improvement, typically the recommendation is to continue with conservative treatment with the hope that the symptoms either resolve completely or at least improve to the point where they're a mild nuisance and not too bothersome to the patient. If these non-surgical options fail, then for certain conditions, we can discuss surgery, which would be, as I mentioned, a last resort type of option typically. Some of the common procedures that we perform in the cervical and lumbar spine would be a discectomy, laminectomy, and fusion. So those would be probably the top 3 conditions or top 3 procedures that we perform. So what are some of the indications for surgery? So isolated neck or back pain is rarely an indication for surgery. It can be sometimes if there is some degree of instability in the spine, or if there's a fracture or infection, which are all fairly uncommon things. So for the degenerative disc disease that I have shown examples of earlier, typically surgery is not an answer because it is not always effective in treating that condition, and is a fairly invasive procedure to try without having confidence that it's going to be effective. On the other hand, arm or leg pain usually responds very well to surgery for the reason that if a specific nerve is compressed in the cervical or lumbar spine, relieving pressure on that nerve almost always relieves the pain going down the arm or the leg. In rare cases, if there's already some nerve damage, that pain might not completely go away, but in my experience, over 90% of the time, if we get to it fast enough, the arm and leg pain can be cured with surgery. So surgery does tend to be very effective for arm and leg pain as opposed to just isolated neck or back pain. The one caveat to back pain is when patients have spondylolisthesis or the slipped vertebra that we saw earlier. In those cases, surgery is very effective in fixing back pain because it essentially restores the normal stability in the spine or removes abnormal movement that tends to happen when a patient has a slipped vertebra. So in these cases, if a patient has back pain and a slipped vertebra, surgery can be very effective in fixing that pain. So here are some examples of the cases that I've done that demonstrates surgical treatment of the conditions that I showed before. So this is an example of a patient who came in with a herniated disc. So again, we're looking at the lower back here. We're looking from the side view, and we're zoomed into the lumbar spine here. So these are, again, the vertebrae. These are the discs that sit between the vertebrae, and this is an example of a disc herniation. So this patient came in with this herniated disc and had severe leg pain going down the leg. They have tried the conservative treatment, so they've tried injections, physical therapy, various medications, and continue to have leg pain. And therefore, we opted to go forward with surgery. The patient underwent what's called a discectomy procedure, which essentially involves making a small incision in the back of the spine here and then going into the area of the problem with a small tubular retractor and then trimming that part of the disc that is sticking out and pushing on the nerve. So this is an MRI after the surgery, and you can see that there's no longer a large protrusion there from the herniated disc, and the pressure on the nerve was relieved with surgery, and the patient had complete resolution of their leg pain. For stenosis or narrowing around the spinal cord and the neck, we do a procedure called a laminectomy. So this is the same patient that we saw earlier that had these protruding discs and narrowing around the spinal cord. The symptoms this patient had were trouble with using their hands for buttoning clothes, writing, and this patient also had significant difficulty with walking, to the point where they went from being able to walk normally to using a cane and then having to use a walker. And the reason for that was because of the significant compression of the spinal cord from the stenosis or narrowing around the spinal canal. So this patient underwent a procedure called a laminectomy, where I went in from the back of the neck and essentially removed some of these bones back here to open up room for the spinal cord. And this is an MRI after the surgery. And what you see here is the spinal cord is very compressed in the picture on the left here because of the stenosis. And on the right side, you can see that the spinal cord is completely free because we've now removed some of the bones and some of the constricting structures that were present in the back of the spine. So that is a procedure called laminectomy, and that can be performed both in the neck and in the lower back. This is an example of a patient who had a slipped vertebra, so the condition called spondylolisthesis. So we see in the picture on the left where the L4 vertebra is slipped forward in relationship to the L5 vertebra. So these red lines that you see are drawn in the back of the vertebrae, and you can see that they're not lined up properly as they are in the rest of the spine. And that's a condition that can cause significant back pain and often also causes leg pain because it causes associated narrowing or stenosis in the same area commonly. And for these kind of problems, what we need to do is we need to stabilize that part of the spine so that it's not moving abnormally, which is what causes the back pain. So for this patient, we went in and cleaned out the overgrown ligament and bone spurs that were present in this area, and then also added a pair of screws on either side of the spine connected with rods, which you see in this X-ray that was performed after the surgery. And then we also put a spacer in between the vertebrae that restores some of the normal height to the disc between the bones. And what happens with these type of procedures is that over time, the patient's own body essentially grows bone across the spacer. And then we also put in some bone chips and synthetic materials in the back of the spine that provide additional area for the bones to heal. So eventually these two vertebrae here become one vertebra essentially. And that's called a fusion procedure. And the screws and the rods that you see here in the X-ray essentially just hold these vertebrae completely still in place, almost like a cast would for, say, an arm fracture, until those bones completely heal together. Once that healing process takes place, the screws are not even necessary, and you could potentially go in and take them out, although we typically don't do that because they don't cause any problems or any issues. So that's an example of treating a slipped vertebra condition with what's called a spinal fusion. One common question that patient asks is, what is minimally invasive surgery, and what is the benefit of doing things minimally invasively as opposed to a more traditional open surgery? And as I always tell them, a picture kind of speaks much better than any words could describe this. And so this is a picture of a standard laminectomy procedure. And what we're looking at here is we're looking at the lower part of the back. So there's been a fairly large incision that was made here. You can see these retractors holding the muscles apart. And there's been a fairly large amount of bone that was removed to free up the nerves that run in this area here. And on the right side, what you see is a small tubular retractor that basically goes right to this area, right to the source of the pain and the stenosis and the problem essentially. And through this small opening, by using a microscope, magnifying everything and using specialized instruments, we're able to clean out all the arthritis that's present in this area, but without making this large incision and really disrupting a lot of the normal structures in the spine, such as the muscles and ligaments that hold everything together. So as you can imagine, this type of incision and exposure takes much longer to heal. It's much more debilitating long-term because we're disrupting a lot more of the normal structures of the spine. So it could lead to problems down the road, such as creating instability between the bones. In this picture here, you can imagine that the incision is very small. So it's basically an inch-long incision or so, that heals much quicker, and the patients recover much faster from. Patients with a traditional open laminectomy typically have to stay in the hospital for at least a day or two to make sure their pain's under control and see physical therapists and things like that. These type of patients very often will go home the same day. So it's an outpatient surgery that is much less invasive. So the main benefits of minimally invasive surgery are shorter length of surgery, much less blood loss, quicker recovery, typically outpatient surgeries. So it's just a much less invasive way to perform a similar type of surgery that is typically just as effective as an open surgery for most patients. So what is the success rate of various surgical procedures? So as I mentioned before, discectomy, which is typically done for arm or leg pain, is greater than 90% effective. Almost always the patient have at least improvement in their arm or leg pain, and most of the time it resolves completely. Laminectomy is slightly less effective, but still upwards of 80% of the time, where people are able to walk much longer, stand much longer, not have the pain radiating down their legs after the procedure. And fusion is somewhere around 70% for resolving back pain when it's done for proper indications, such as slip vertebra that I showed previously. What are some possible complications of surgery? So bleeding and infection are kind of just the standard risks of any type of surgery. And the more extensive the surgery, the higher those risks become. For the minimally invasive surgeries, these risks are very small. I would say less than 1% chance of any type of significant infection or bleeding to occur. Spinal fluid leak. So this is a Complication that is sometimes seen, especially for laminectomy surgeries that are done to relieve the stenosis or narrowing in the lower back. And what that refers to is there is a membrane that contains spinal fluid around the nerves, and sometimes the arthritis and thickened ligament and bone spurs can be adherent to that membrane. And when we're cleaning out that arthritis, that membrane can tear and some of the fluid can leak out. Most of the time, we're able to fix that during the surgery because we're able to see where the leak is. So it's more of a nuisance. But sometimes if the leak is very small and not detected during surgery, sometimes it requires additional procedures or surgeries to fix. Nerve injury, a very uncommon complication of surgery. With the modern instruments and microscopes, we're able to see everything very well. So it'd be very uncommon to have any type of nerve injury, but it is a theoretical complication of any spine surgery because we are working around the nerves and sometimes the spinal cord. For the fusion procedures, because we're putting in hardware, so to speak, we're putting in screws and rods and spacers between the vertebrae, there's always a chance that there could be problems with these components after the surgery. If a screw were to break, for example, or back out of the bone, or if the spacer comes out of its place. So those are some of the possible complications, but again, fairly uncommon to see that. So what is the typical algorithm or treatment pathway if you're having back, neck, arm, or leg pain? So what we typically tell patients is to start conservative. So we usually tell patients to call their primary care physician when symptoms begin, because a lot of the time, the back and neck pain and even arm and leg pain will resolve over time with some conservative treatment. So it's not necessary to see a surgeon right away. Most of the time, the primary care physicians will prescribe some modality of conservative treatment, whether that's anti-inflammatory medications, a course of physical therapy or chiropractic adjustments, a referral to a pain specialist for injections. That's a fairly common approach to most problems in the back and neck. And as I mentioned before, 4 to 6 weeks is kind of the minimum period of time to give for conservative treatment to see if it's working. In some cases, even a longer period of time is appropriate, and most primary care physicians know how to handle that. The exceptions to that are if there are red flags present, and what we mean by red flags are things like severe weakness in the arm or leg, any bowel or bladder incontinence, fevers, weight loss, other symptoms in the body. So anything that's indicative of possible infection, cancer, or severe spinal cord compression, those type of patients typically are sent to the emergency room or are seen urgently in the office. But if it's mostly pain, a little bit of numbness, tingling, things like that, those type of problems can typically be handled with conservative treatment first. And if that doesn't work, then the next step is typically to obtain an MRI. And again, an MRI is not necessary if the symptoms are mild or moderate and do not involve any of these red flags. But if the conservative treatment fails, then typically an MRI is obtained to see exactly what the problem is. And then if the MRI is abnormal and there is a potential problem that could be fixed with surgery, then the primary care doctor will typically refer the patient to us. And then, of course, we do a consultation, examine the patient, and review the imaging with them, and then schedule surgery if it is necessary and appropriate. One additional avenue that we have available at Rush Copley is a back and neck pain clinic. So this is in place to help the primary care physician properly manage those patients that have new onset of back pain or neck pain, and to help facilitate the appropriate treatments. Specifically, we have an advanced practice registered nurse that sees patients in the back and neck pain clinic. She examines each patient. If there is any imaging, she'll review the imaging with them and then recommend the appropriate conservative treatment. So things like physical therapy, pain management, etc. and she will guide the patients through that conservative treatment and essentially see if it's working. And if the therapy, injections, and other conservative measures are not working, then typically we will order an MRI of the spine and then have the patient see one of the neurosurgeons to see if surgery is necessary. So this is just another avenue for those patients who start having new symptoms in their back and neck, especially if they're having associated arm and leg pain. It just helps to streamline the process and get the proper treatment going quickly, and then facilitate the appropriate imaging, and then get the patient to see one of the surgeons if it's necessary. So that is a resource that we have for our community patients, and that's the phone number to schedule an appointment to see our advanced practice RN. So that is all I have for you. Thank you so much for your attention. If you have any questions, please don't hesitate to reach out to us, and we'll be happy to see you in clinic.